Right, right. Why don't you give us a short talk on, say, carpal tunnel syndrome? I think it's people have heard about it. Uh, Many people don't know much about it.
That's right. So, carpal tunnel syndrome, basically a condition where there is tightness of the nerves of the wrist. There's a tiny nerve that passes through the wrist called the median nerve. So, due to certain conditions, there can be tightening of the fascia around the nerve. So that lead to certain symptoms such as numbness, pain, and it typically spares the little finger. So the numbness and the pain usually the thumb, the index finger, the middle finger, and the ring fingers are affected in this condition. So those four fingers are affected. The little finger is relatively spared. So the symptoms are more common at night, and the numbness and the pain sometimes can extend to the forearm and till the upper arm also, but normally it doesn't cross beyond the shoulder.
Right.
Usually the pain and symptoms
Yes,
are
sir.
concentrated around the wrist and the palm region. And so there's an easy way to identify or diagnose this condition, that is nerve condition study. Clinically we can do some tests like Tinel sign, Fallon sign, in which it is positive, that is by tapping on the nerve, paresthesias or tingling sensations can be elicited. That is an indirect way to diagnose the condition, but confirmatory is by doing a nerve condition study which shows abnormalities in the median nerve. So there are different grades of carpal tunnel syndrome. There is mild, moderate, severe, and mild and moderate maybe some physiotherapy and medications can help. But if it is severe carpal tunnel syndrome, then they might have to go for a release surgery. Release surgery
Right,
is whereby the tight fascia is released and the nerve is kind of loosened. So it's
right,
usually done by orthopedicians or surgeons, and they have it's almost like a permanent cure for the situation.
right.
Yeah.
Exactly. I think the awareness has increased recently since the IT boom, right?
Mhm.
So, because of the increased use of mouse. So, what are some of the causes for carpal tunnel syndrome? Who was prone to it?
That's right. So, usually it's seen in people with hypothyroidism, thyroid disorders, diabetes, people who gain a lot of weight said like in a short span of period,
Right.
people who are pregnant. That is a lot of water retention and
Mm,
hormonal
mm.
changes can cause tightening of the nerve.
Right.
So these are the main conditions. Then people with rheumatoid arthritis and arthritis can also cause, and repeated usage of wrist, as in using a lot of computer keyboard, these
Right.
things, and musicians who use keyboard a lot.
Correct.
So these are
Exactly.
the common causes.
Right. Right. And I think because it's such a common condition, I think the most common nerve condition that I see in the OPD is carpal tunnel syndrome. And many people actually tend to neglect it, right? Only when
Yes.
it. I've seen a person who had a lot of pain because he was, he was a cook's assistant. He was grinding using his hands to hit, the Indian way, and he had so much carpal tunnel syndrome that he had totally lost the abductor pollicis, this muscle, and
Mhm.
he ignored it till that stage. So, what do you think we should do when somebody, feels the symptom more?
Sorry, what do you think, sir?
Yeah, yeah. What do you think the people should do? Like, initially people tend to ignore it, but then what happens is, as time goes, the symptom may reduce, but the problem may not go away. Right? Actually, it is worsening.
So, untreated carpal tunnel syndrome can lead to muscle loss around this
Yeah.
area. It's called the thenar area. So, muscle loss and can lead to
Right.
weakness of the thumb. That
Right.
is what happens when you leave it untreated.
Right.
But yeah, like I said, mild or mild to moderate cases can be managed with physiotherapy, weight reduction,
Right.
and treating the underlying condition,
Right.
medications. Some short course of steroids are also tried in some cases. But
Right.
if the condition is like beyond moderate, I would say like go for surgery so that you don't lose your muscle around this area.
Right.
So
Right.
yeah, severe symptoms, definitely surgery is the best management.
Right. So it was really nice talking to you. I think we touched upon some very useful things, and I'm sure people will gain something from this. And we'll keep doing this in the future. We'll take up more such topics and make short videos on these topics. Okay?
Sure, sir. With better
Right.
preparation.
Right. Right. Let me
Okay, sir.
see.